Hi, I'm Michelle. I'm the biology teacher here. These guys are performing something.
Our patient Ben is suffering from coronary artery disease. He recently had a heart attack and needs a heart transplant. Our surgeon May Wish will be performing the surgery with the assistance of Nurse Chantel. Every year in the U.S. alone, 4,000 people are in need of heart transplant surgery, and only 2,000 donor hearts will become available. To ensure successful transplantation, the donor hearts will be transplanted into a patient's body within 6 hours of harvesting. This procedure begins with the patient being put into a deep sleep with general anesthesia. Then, the patient's chest is sterilized in order for an incision to be made. A cut is made through the breastbone. This procedure provides access to the heart and lungs for surgical procedures such as a heart transplant.
Oh, that rib cage.
Next, the great vessels are disconnected, such as the vena cava, pulmonary arteries, pulmonary veins, and the aorta. Then the patient's arteries and veins are hooked up to a bypass machine. This machine pumps blood into the severed arteries and veins in order to maintain blood flow through the patient's body. Then, the patient's diseased heart is removed from the patient's chest cavity. Then, the donor heart is put into the chest cavity. The arteries and veins are stitched together as the bypass machine is disconnected. Blood begins to flow through the transplanted heart. An electric shock is used to start the heart beating. Lastly, the chest cavity is closed and sewn back together. After heart transplant surgery, patients are immediately given high doses of immunosuppressant drugs to prevent the body from rejecting the donor heart. This ends the heart transplant surgery.
Wow.